My name is Luke Funk, and I'm the editor-in-chief of Annals of Surgery Open. I've been in this role since January of 2025 after serving several years as an associate editor for the journal. I am also a professor of surgery at the University of Wisconsin-Madison, and I'm a health services researcher focused on obesity treatment and outcomes. Clinically, I'm a minimally invasive and bariatric surgeon, and I would say from an editorial perspective, I'm very excited about helping to guide and lead the journal, over the next 5 to 10 years at least. So I've always enjoyed learning new things in surgery and participating in disseminating new knowledge, whether it's through my own research team's work, national conferences, or the editorial process. When the opportunity came up with Annals of Surgery Open, it seemed like a great fit, being the sibling journal to Annals of Surgery, which is a highest cited journal, surgical journal, but with the reach and accessibility of open access. And I saw it as a way not just to publish excellent work, but to make sure that it gets in the hands of surgeons, researchers, and policymakers around the world quickly and without barriers. So they're sibling journals, and I would say that we share the same commitment to quality and rigor in research. Annals of Surgery focuses, I would say, on publishing the most definitive, often large-scale studies that shape the field. I think Annals of Surgery Open may have a bit of a broader scope. We welcome innovative methods, exploratory work, important negative studies, studies that might be focused on education or surgical history, and topics that might be more specialized but still have significant impact. And being open access means that anyone, anywhere can read and use the work immediately. Absolutely. We're really interested in research that directly changes policy or practice. This includes health services research, global surgery, implementation science, innovative surgical techniques, and the use of big data and artificial intelligence. We also want to highlight qualitative and mixed methods research because it often provides the why and the how behind the quantitative research. So I think there are three things that are critical: clarity, rigor, and relevance. A strong manuscript has a clear research question, a solid and a transparent methodology, and results that can answer an important gap in the literature. And the discussion should make it clear why this work matters, not just to other researchers, but to patients and other surgical teams around the world. I think because we combine the high editorial standards of Annals of Surgery with the accessibility of open access, that means broad global reach and impact, plus a fair and constructive peer review process. Our goal is to work with authors to bring and disseminate their findings and get it into the hands of the people that can act on it and use it. I see Annals of Surgery Open as a leading open access surgical journal in 5 years. I see it as the first place that researchers are going to think of when they have innovative practice-changing research. We really want it to be a hub for international collaboration and a driver for surgical care and improvement around the world.